All right, guys. So today we're gonna be reacting to the real reason American healthcare is so expensive. It is true, our healthcare system is so damn expensive, man. It's very expensive, folks. Very expensive. A lot of money is being wasted. Go left and right. It's like a very loose system, I would say. Also, we have further governments guaranteeing some programs. So a lot of these companies they just raise the price because guarantee money is coming in for those services. So that's another problem as well. But we're gonna react to this. The real reason American healthcare is so expensive. Let's see what this guy has to say. Let's jump in.
You how obsessed I am with this chart. It shows exactly what is wrong with America's conversation about healthcare. On one level, you've seen this chart before. It shows healthcare spending as a share of the economy of a bunch of countries. There's Germany and France and Japan and Canada and oh, there's America. But now I want to add something you haven't seen to this chart. This is how much of that spending in each country is private and how much is public. Here's what's amazing. America's government spending on healthcare, on programs like Medicaid and Medicare and the VA, our versions of socialized medicine, it's about the same size as these other countries. These countries where the government runs the whole healthcare system. And then there's our private spending. It's the private insurance system that makes healthcare in America so expensive. Conventional wisdom says the government is more expensive than the private sector. It can't say no, it's corrupt, it's inefficient, it's slow. You want something done right, you give it to the private sector. That is what we hear in America all the time. And yet here we are with the biggest private sector spending the most. Why is a free market so bad at controlling the cost of healthcare in the United States?
Well, it is not free market when you have the federal government guaranteeing a lot of these private companies. It's not free. If you have the government coming in, bailing some of these companies, it's not free market. It's not free market. Free market literally means just the government literally competing with the other. So the government has to be competing with the other companies, right, to be free market. But free market is not when the government is just guaranteeing money to certain companies. That's what happened with Obamacare. I understand what Obama wanted to do, but the problem was that Obama was guaranteeing a certain amount of money to these private companies. So this private company would just increase their prices and deductibles. So deductible will be through the roof, right? So that's one thing. Let's see what this video has to say.
If you look at the data on physician visits and hospital discharges, you can get rid of one theory. Americans don't consume more healthcare than people in these other countries. We don't go to the doctor more than the Germans or the Japanese. In fact, we go to the doctor less. The difference between us and them is that we pay more. Every time we go to the doctor for everything from an angioplasty to a hip replacement, from a C-section to a pain reliever, in America, the price for the same procedure at the same hospital, it varies enormously depending on who is footing the bill. The price for someone with public insurance, like Medicare or Medicaid, is often the lowest price. These groups, they cover so many people that the government can demand lower prices from hospitals and doctors, and they get those lower prices. If the doctors and hospitals say no, they lose a ton of business. They lose all those people on Medicare, all those people on Medicaid. But there are hundreds of private insurance companies, and they each cover far fewer people than a Medicare or a Medicaid. And each one has to negotiate prices with hospitals and doctors on their own. And if you're uninsured, you have even less leverage. Nobody is negotiating on your behalf. So you end up paying the highest price. One study found that most hospitals charge...
And that's depending. They say, I remember when my wife was pregnant with our first daughter in New York, she was going to the hospital. I mean, to the clinic, not hospital, clinic, every week. So these people were just, sucking all their money for the insurance company. It can get crazy, man. It can get crazy. Our system is a little bit effed up.
Charge uninsured patients 4 times as much as Medicare patients for an ER visit. Other countries, they don't have this problem. Instead of every private insurance company negotiating with every healthcare provider, there's just this big list. Country, the central government, they go and they say, if you want to sell to us, to all of our people, then here's what you can charge for a checkup. Here's what you can charge for an MRI or a prescription for Lipitor. So then whether that bill goes to the heavily regulated private insurance companies in Germany or directly to the government like in the UK, each country is telling the doctor or hospital or drug company how much that bill will be. And because the government controls access to all of the customers, it's an offer that hospitals and doctors and pharmaceutical companies typically can't refuse.
I'm going to make him an offer he can't refuse.
In America, the idea is that you'll be a consumer, that you'll do what you do when you go to Best Buy and buy a television. But that just doesn't work in healthcare. It doesn't work in healthcare because you often come and get healthcare when you're unconscious in an ambulance, when you're scared, when it's for your spouse or your child. It is a time when you have the least bargaining power. You are not usually capable of saying no. You're not knowledgeable enough to do it, you're not comfortable doing it, or you're not conscious enough to do it. That's why in other countries, the government is a person who can say no for you, who can say, no, that's too expensive, you're gonna have to lower your price, because they...
Interesting statement. Interesting statement. He might be right. Listen, folks, he might be right. I'll be the first one saying I'm kind of ignorant when it comes down to this topic. I used to work in the final expense industry, and the problem is that in United States we have a problem with people not taking care of themselves. We have a lot of unhealthy people, man. I'm talking about people that don't eat well, that have diabetes, and it's like the system is being overrun by very unhealthy people, right? You have the people with the type 2 diabetes or type 1 diabetes with neuropathy, cutting limbs, and all high blood pressure with congested heart failure, and they have a valve in their heart and they not taking care of themselves, so they always go back to just get more treatment, but then they're not taking care of themselves, so that in the long run will just put a huge strain in their system. So that's one thing. And I noticed that we have millions in America like that. Our diet is another problem, right? So a lot of these things can be just taken from these great countries where we have to check their diets, their mortality rate, all these things, to just even have the conversation of what the United States will look with a basic healthcare system that is free for the public. You see what I'm saying? And then we have to take in consideration what type of a skilled employee we're going to be putting into this system. I'm just saying, right? Putting this out there.
Power.
A new push for single-payer health care right here in the U.S.
Single-payer! Now!
California and others are saying maybe we should adopt the European model.
If we decided to create a single-payer system with one of these huge price lists in the U.S., there'd be nothing to stop lobbying from hospitals, from doctors, from drug companies, and those prices would get influenced. So we could end up with a single-payer system that is expensive, even as expensive as our current system. It all depends on how much you negotiate down the prices. And now in America, these groups have so much...
Yeah, but this is the problem. The United States government is not good negotiating prices. It's one of the worst in the entire Western world. One of the worst. They negotiate always losing money. That's what the Obamacare did, right? The Obamacare was just literally, just to put it simple to you guys, is the federal government just guaranteeing money to private companies for folks that don't have healthcare to use it. So a lot of these healthcare companies, let's say, just put an example, let's say a pill will call you, like, let's say some aspirin will probably call you like $100, right? Whatever. I'm just putting this in an example. I really don't know the exact number. But then, because the federal government is just guaranteeing the purchase of that aspirin, I can charge it, right? I can charge it as $120. The CVS or Walgreens. And then it goes like that. And then next year it's $125. And then $130. Right? Because that money's already guaranteed. And that's what happened with colleges, right? Colleges right now, the reason the colleges in the United States are very expensive is because of the student loans. The federal government is just guaranteeing the enrollment of these institutions. So their service, therefore, because it's guaranteed money, I'm going to increase the prices. Right? Let's say 20 years ago, a regular just credit from a university will cost you $150. Now it's probably cost you almost $1,000 per credit, because the majority of that money is coming from the federal government. See, the federal government in the United States is not good negotiating. It's very bad. Probably different from a lot of countries from the Western world. Probably they do better in Europe negotiating these prices.
Much power because they are so rich that it's really hard to get them to bring down the prices. This is the irony of American healthcare. It's so expensive that it's become hard to make it cheaper. All that money they make, that becomes political power, and years and years and years of overpaying. Those are huge industries now, and they have a lot of influence in Congress.
That's true.
Under a single-payer system, if we did drive prices down, doctors and hospitals, they would be paid less than they are right now. That might mean some of them close, or some go out of business, or some move. It would be really painful. One person's waste is another person's essential service or local hospital.
Also, we pay them a lot. A nurse in the United States can make you $150,000 easily a year, and working only 3 days a day, 3 days during the week for 12-hour shift. And what they do is they work 36 hours, but then they mash it up to 40 hours. So they're not even working the rest of the 4 hours. Doctors can make you almost $300,000 a year easily. See, how would you dismantle that? How would you make it even appealing to some other folks to just work as a nurse with less money? That's another thing, right?
Or their income. But then
let me know what you guys see in the comment section below.
It's not an all or nothing choice. For instance, there's a really interesting section of Bernie Sanders' Medicare for All bill where he lays out this interim plan. It's a plan he wants while he's setting up his new single-payer system. And in that plan, he expands Medicare to cover vision and dental, and he opens it to nearly everyone, not just people 65 and older. All kids go on Medicare automatically, and most adults can buy in. That plan on its own, it wouldn't get American healthcare spending far down overnight, but it would at least begin to recognize what we already know, and what most other countries already do, that healthcare is one of those things the government can do cheaper and better than the private sector.
Good video, very good video though. Good video, very good informative stuff. Amazing. Here's the thing, a system like this could work in the United States. Don't get me wrong, it could work, but you have to dismantle the entire system of the healthcare industry, right? And I would just, because the United States spend a lot of money in public money, public healthcare. So that has to dismantle, fix it out. Do not guarantee increase of prices, right? Just guarantee a minimum of the product, right price. It mean like they do in Europe. But I would start with something very basic, right? Checkups and dental, things very basic. But you have to dismantle the entire thing. And then I will only hire a high skillful labor force, right? Only skill. Like you have to have not only a bachelor's degree, but master's degrees, right? You need to have very competent people to work on those fields. And reduce a lot of these hospitals. Reduce them and, this is just, of course, in more like a fairy tale kind of thing, because I don't see this in the United States happening, folks. I'm gonna be very honest, because our federal government is very undisciplined, right? And we print money left and right, and it's not a good system, right? I'll even take the federal government in the current state that we are. I'll take the federal government route. Boom. Because without federal government, hospitals cannot increase prices. Hospitals increase prices, that means the private company has to increase prices. I can say no to the private company. That means the private company will go bankrupt. So that would literally just force hospitals to reduce their prices. You see how that works? Now, if I have federal money coming in, I can increase the prices as a hospital because it's guaranteed money. That's how the United States works. A little bit different. It, of course, comes down because our system is a little bit undisciplined in that regard. That it can work in the United States, sure, it could work. But again, you have to change the entire structure from the bottom to the top. Like, change everything. Let's see what happens. Maybe a couple states might. I know some places like New York, they have systems like that. California, system like that, where you don't need to have healthcare in order for them to even take you. But they're not the best, right? They're not the best. Not because the system itself, it's just the result of it. The people that are behind it. It's all, I don't know. Let's see if they can just try this and see how it works. It maybe works, right? Nothing wrong with trying, right? There's nothing wrong. But let me know what you guys think in the comment section below. Like always, I'll see you in the next one.